So why are the kidneys so important? You know that the kidneys filter the blood and remove waste products and excess fluid from the body in urine, but the kidneys are also the long-term regulators of blood pressure. And this is especially important for you if you yourself or someone you know has high blood pressure. So today we're going to talk about how the kidneys control blood pressure and how medications that are prescribed to treat high blood pressure actually work. If you look at figure 26.6, you'll see the renin-angiotensin-aldosterone system. The system consists of the three hormones, renin, angiotensin 2, and aldosterone, that work together to regulate systemic blood pressure. Looking at the top of the figure, you can see the stimulus for renin release is a decrease in systemic blood pressure or blood volume that might occur if you have a hemorrhage or are dehydrated. So I have drawn a schematic to simplify this somewhat. When renin is released from the kidneys, it acts as an enzyme and converts angiotensinogen into angiotensin 1. Angiotensin 1 is then released into circulation. It travels back to the heart, and you know that the right side of the heart pumps the blood to the lungs. The vascular endothelial cells of the lungs contain an enzyme abbreviated ACE, which stands for angiotensin converting enzyme. This does just what it sounds like. It converts angiotensin. Specifically, it converts angiotensin 1 into angiotensin 2, which is then released into circulation and pumped out to the rest of the body by the left side of the heart. A couple of the target organs of angiotensin 2 include the posterior pituitary, which is stimulated to release ADH, and the adrenal glands, which are stimulated to release aldosterone. If you look at this figure again, you can see the effects of aldosterone. It targets the distal convoluted tubules of the kidneys and stimulates them to reabsorb sodium. Remember that wherever sodium goes, water follows. So this increase in sodium reabsorption is going to increase water reabsorption as well, thereby increasing blood volume. And how are blood volume and blood pressure related? Good, they're directly related. So the increase in blood volume is going to bring about an increase in blood pressure, which is the desired outcome or effect, given that the stimulus was a decrease in blood pressure. If you look at figure 26.8, you can see the effects of antidiuretic hormone or ADH. I want you to think about the name of that hormone for a minute. Antidiuretic. What is diuresis? Urine formation. Good. So antidiuretic, it opposes diuresis. Instead of eliminating water from the body, the kidneys are stimulated to conserve water. So ADH targets the collecting ducts of the kidneys and stimulates them to reabsorb water, thereby decreasing urine volume. And remember, urine volume and blood volume are indirectly related. So this is going to increase blood volume or plasma volume. See if you can fill in this flow chart, which shows the effects of angiotensin 2. So again, renin release is stimulated by a decrease in systemic blood pressure. Once released, it converts angiotensinogen into angiotensin 1, which is then converted into angiotensin 2 by ACE. Two of the effects of angiotensin 2 are the release of ADH and the release of aldosterone. So what does ADH do? Good. It increases water reabsorption. And aldosterone, good, increases sodium. Water's going to follow. So it increases sodium and water reabsorption. What effect is the increased water reabsorption going to have on blood volume? Good. It increases blood volume. They're directly related, so this will bring about an increase in blood pressure as well. So that's how the renin-angiotensin-aldosterone system regulates blood pressure. If you have high blood pressure, you might be prescribed an ACE inhibitor. This is a drug that inhibits angiotensin converting enzyme. So by inhibiting this enzyme, angiotensin 1 cannot be converted into angiotensin 2. And remember, all of the effects of angiotensin 2 are to raise blood pressure. So by inhibiting the formation of angiotensin 2, the effect of these ACE inhibitors is to decrease blood pressure. So the ACE inhibitors are prescribed to treat hypertension or high blood pressure. Are there any questions? So I want you to know what the stimulus for renin release is, and I want you to be able to tell me how ADH and aldosterone work. They both increase blood volume and blood pressure, but they work by slightly different mechanisms. So I want you to be able to explain the effects of these two hormones. Hopefully, I've given you enough information to answer the questions in this case study. I want you to focus specifically on that part of the case dealing with the renin-angiotensin-aldosterone system.